My name is Dustin Sulak. I'm a physician and I've been practicing in Maine for the past 10 years under the principles of integrative medicine, which combines the best of conventional medicine and the best of alternative medicine, staying open-minded to new paradigms, taking into account people's body, mind, spirit, family, and community, and emphasizing safe, more natural, and less invasive treatments whenever possible. While cannabis has many properties that can relieve physical ailments, one of its additional benefits, which is probably one of its primary benefits, is that it can change one's consciousness in a way that affects our relationship with our symptoms and our relationship with our suffering. So what a lot of people call the high or the psychoactivity of cannabis is a transition for a lot of people to relate to themselves in a new way. This not only can decrease the intensity of the symptoms, but it makes symptoms less bothersome and improves quality of life. People often report to me that they're able to see themselves from a new perspective. They're able to solve problems with creative solutions, that they feel more connected to nature, more connected to God, more connected to their families, that they're able to reside their consciousness in the present moment instead of worrying about the future or worrying about the past. All of these things make a global impact on someone's quality of life. In the state where I practice, patients often start by purchasing cannabis from somebody else. Then they'll usually start growing it for themselves, and I see an incredible transition when they do so, because planting a seed or starting a clone of cannabis in the soil and watching it grow is an incredibly therapeutic process, because it signifies that life is present and people have something to look forward to every day. They're taking care of their plants, they're taking care of themselves, and they feel empowered and self-sufficient. When the harvest time comes, they can produce their own medicine, and in an outdoor setting, no bigger than an average garden, a person can produce enough medicine to last them an entire year. It's extremely economical for people that have limited resources and can't afford the more expensive treatments that are also more dangerous and less effective. It's an extremely safe medicine. While it does have some side effects that are typically dependent on the dosage, it's non-toxic, which means that if a person accidentally took 10 or 100 or even 1,000 times the dose I recommended for them, they would have no long-term damage. No brain damage, no liver damage, no kidney damage. They might have an unpleasant 12 or 24 hours, and then they would return to their baseline. There is substantial evidence, conclusive evidence according to my government's recent report, that cannabis is safe and effective for the treatment of chronic, non-cancer pain in adults, as well as cancer pain. Also for relieving spastic muscles associated with multiple sclerosis, and for relieving chemotherapy-induced nausea and vomiting. There's conclusive evidence for those conditions, but then there's moderate or limited evidence for about 20 other conditions. So very suggestive, but not the gold standard medical trials that the rest of the scientific world wants to rely on. We need more studies. So while a lot of people talk about cannabis relieving symptoms, there's also a lot of questions about how can cannabis change the underlying disease process. For example, we know that cannabis has many anti-inflammatory properties, and that many chronic conditions that affect people these days are related to low-level inflammation. And this includes things like heart disease, stroke, and cancer, some of the biggest causes of mortality, biggest causes of death in populations globally. So if cannabis can be used to promote sleep, it would prevent chronic disease. If it can be used to reduce stress, it would prevent chronic disease. If we can use it to reduce inflammation and improve quality of life, then we have a much lower healthcare burden on the system. Cannabis is an incredibly effective aid for sleep. This is one of the most profound improvements I've seen in my patients globally, across every condition, whether it's someone with psychiatric illness, gastrointestinal illness, neurologic illness. It's very hard for someone to heal from any condition if they're not sleeping well. And so by promoting sleep, cannabis does not disrupt the architecture of sleep, unlike a lot of medications that will make you sleep, but the quality of sleep is non-restorative. Cannabis, when used at the appropriate dose, produces good quality sleep that restores and allows someone to heal. If you look at the evidence for sleep disruption, you can see that it's highly correlated with other conditions like arthritis, stroke, and cardiovascular disease. So for people that have sleep disturbance, it's important to target that before they get sick with these other more serious conditions. And I think cannabis is one of the best tools we have to address sleep outside of lifestyle modification. Most of my patients that experience adverse effects from cannabis do so in the first week or two after they start using it. And it's almost always due to a dose that's too high. So if we get the dose right, we start low and we go slowly, many of my patients never experience a single adverse effect. But when they do, the most common are dry mouth, feeling tired or fatigued, feeling imbalanced or dizzy or clumsy, and feeling forgetful. And those usually resolve very quickly with a little dose adjustment. The more serious adverse effects like nausea, vomiting, diarrhea, hallucination, these are only occurring when someone makes a huge dosing mistake and takes way more than they need. What I see most commonly in my practice is chronic pain. This is about 70% of my practice. I also treat quite a few people with post-traumatic stress disorder, PTSD, and there's certainly a lot of overlap with chronic pain. And when I say I'm treating chronic pain or I'm treating PTSD, I want to make it clear that I'm not just treating one symptom. Someone with PTSD may have anxiety, they may have nightmares, they may have avoidance traits in their behavior. All of these things improve. So cannabis is not just treating one symptom, it's a global treatment. I treat probably around 200 children with severe neurologic conditions. These are children that are referred to me by the pediatric neurologist because they've run out of options. These children get incredible results with cannabis for seizures, for spasticity, for gastrointestinal problems, and for pain. I also treat many patients with cancer, people that have cancer that are proceeding through conventional treatment like chemotherapy and radiation, and people that have cancer that do not want traditional treatment and they only want to use cannabis either to relieve their symptoms and improve quality of life, or every once in a while we find that cannabis has direct anti-cancer results and can shrink tumors. This isn't the case for everyone, and we still have a lot to learn about how to improve our results with this. But when I do treat people with cancer who are going through the conventional treatment, they find that they have much fewer side effects. They're more likely going to complete their course of treatment and more likely to be successful. So we speak about cannabis like it's one medicine, but really it's hundreds of medicines that come from one plant, because there's all these different varieties of cannabis, each with its own distinct therapeutic properties. And then the method of consumption makes a profound difference on the effects of cannabis. So for example, when someone inhales cannabis via smoke or vaporizer, this has a very rapid onset. In 1 to 5 minutes, people will start to feel relief, but it doesn't last very long. Therefore, this is not the ideal method of consumption for someone who has a chronic problem that's present all day, every day. For someone like that, it's better to use an oral delivery method, especially taking advantage of all the blood vessels in the mucosa of the mouth, because that's a great way to absorb cannabis. So this would be drops or sprays of a liquid cannabis extract. The onset is usually around 15 minutes. People begin feeling relief, and it can last 4 to 8 hours. So people usually dose 2 to 3 times daily. I also see impressive results in my patients in people that are using cannabis topically on their skin, either for inflammatory skin conditions, to relieve itch, and in many cases to relieve arthritis that's localized to a single joint. Every time I come to Chile, I'm more and more inspired by the cohesion of the cannabis community here and the determination to do what's right for people. This is a global movement, but Chile is an excellent example. And I'm leaving Chile this time again inspired to go back and do the work that's most important to do. I cannot say that in Spanish. Pero puedo decir que me encanta estar en Chile con Fundación Daya y todas las personas que trabajan mucho a hacer cannabis. I can't.